Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's walk through a routine teeth cleaning appointment at the dentist. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to discover all of the essential components for an effective oral hygiene routine at home. Because keeping up with your dental care at home will make your checkup appointments easier and more comfortable, just like the one we're about to watch now. So without further ado, here is what to expect at a routine dental cleaning and checkup. First, you'll most likely be greeted in the waiting room. The hygienist usually calls your name and brings you back to the room. Next, they'll usually place the bib on you and ask how your day's going, some small talk, how's the weather, things like that. They will go over any changes in your medical history, any new medications, any recent hospitalizations, gotta update your health history. They'll also ask how your teeth are feeling, if anything's bothering you in your mouth, or if you're just here for a routine cleaning and exam. Next, they will let you know if you're due for x-rays. Bite wing x-rays are usually taken about once a year, depending on your cavity risk. Here's the sensor used for the digital x-rays. Bite wing x-rays are just 2 pictures on each side of the mouth, and they are specifically to check for cavities, tartar, and the level of the bone that holds your teeth in. Sometimes if you have a high cavity rate or your bone is being monitored for gum disease, these may be taken at every cleaning appointment. This is one of my favorite parts as a hygienist because I get my exercise in walking back and forth to press the button. Here you can see a little closer up on how we put those in your mouth. I know they're not the most comfortable things, but ooh, look how good that picture is. That was a good premolar shot. And if you're interested in what is actually going on in the x-ray photos, I will link my How to Understand Dental x-rays video if you want to learn more. I point out all of the things we're looking for in your photos. Okay, so every 3 to 5 years, they may take a routine full mouth x-ray, FMX. These ones are checking the roots of every single tooth, all the front teeth and all the back teeth. About 18 images are taken in a full mouth x-ray. You can see the roots of the tooth here versus the bite wings that don't show the roots. It is possible your dentist would want to take a panoramic x-ray instead at the 3 to 5 year mark, which is shown here. These are generally taken to examine the wisdom teeth or the jaw, TMJ, or other surrounding structures. Next, before your cleaning, we need to check your gums. About once a year, we use a little ruler called a perioprobe, which takes measurements of your gums in millimeters. Basically, there's a natural space between your gums and your tooth, and we are measuring that space to check the bone and the surrounding tissues. It's the gum check. Healthy tissue is between 1 and 3 millimeters, so 1s and 2s and 3s are considered within normal limits. 4s are considered borderline, possibly an area of inflammation or tartar, and the number 5 and up often indicates bone loss or gum disease in that area. We check these numbers once a year to confirm your gums are happy and healthy. As you can see here, these numbers are recorded in your chart for comparison throughout the years. The black numbers 1, 2, and 3 are healthy, and the red numbers 4 and up show the areas to be monitored. One more thing before we jump into the cleaning, either before or after, the hygienist and or dentist will do an oral cancer screening. They will check the lateral sides of the tongue, underneath the tongue, the insides of your cheek, the inner lips, and the back of the palate and throat for any suspicious lumps or bumps. I also have a video more about oral cancer screenings if you want to learn more, and also how to check yourself at home. Now it's time to get the tray ready for your cleaning. The reason you are here, you want clean, shiny teeth. First, we will usually start with an ultrasonic scaler, either a piezo ultrasonic or a Cavitron ultrasonic. This instrument takes off most of the tartar, stain, and plaque very well. The combination of the ultrasonic vibrations, the flushing of the water, the high pressurized water cleans the teeth very well. The suction will be in your mouth the whole time. It's a lot of messy water. It's not quite the spa, but we do what we can. Next, the hygienist may blow some air on your teeth and then start scaling with hand instruments, the instruments that make those scraping noises. The drier the tooth, the easier it is for us to see any residual tartar, so we're just airing off your bubbly saliva to see better. After the teeth are smooth from the scalers, it's time to polish. There are 2 ways to polish. One way is with a polishing cup and paste, as seen here. Today, our patient chose strawberry flavored paste. The goal of polishing is to remove stain and make the tooth surface smooth so plaque is less likely to adhere or to attach. Now, just for the sake of this video, I'm pretending to air polish. This is the other way you can polish teeth. I don't use this very often. I think it's very salty and messy, but some people love it. Also, again, we are just pretending here. If we were really air polishing, she would be wearing all of the protection on her face. On rare occasions, I do use this, but most of the time I use the cup and paste where you get to pick your flavor and everyone is happy. Lastly, we floss. We floss all of the contact areas very well. We use correct technique. You can see my flossing video on how to floss properly. I will, of course, link it. And before you leave, most kids and some adults will receive fluoride depending on your cavity and sensitivity risk. Generally, there are two options: the fluoride trays, which we are showing here now. They are great, but you cannot eat or drink for 30 minutes after. The fluoride varnish, which is shown now, is the other option, and it is great because you don't have to wait to eat or drink. The only downside to this one is that sometimes your teeth feel a little sticky for a while after. Okay, now that we are done with your cleaning, after your exam with the dentist, you'll schedule your next cleaning appointment, get a goodie bag, and enjoy the rest of your day with clean, shiny teeth. And don't forget, although visiting your dental office routinely is extremely important, what you do at home every single day in between your dental appointments is just as, if not more, important. So be sure to keep up with your daily routine of brushing and flossing at home. And if you're interested in creating the perfect routine at home, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide. I hope you enjoyed this video. Please like, subscribe, and turn on your notifications if you did. And if you want even more dental tips, you could hang out with me on Instagram at Teeth Talk Girl. Peace, love, and teeth.